Good day. We've got CEO Chris Dobbin of Nova Leap Health joining us today. Nova Leap is an acquisitive home healthcare services company operating in the US and Canada. Chris is here to discuss the company's recent Q2 financial results, which included record EBITDA levels. It's Monday, August the 14th. I'm Martin Gagel with Market Radius Research. Please remember, this is neither recommendation nor investment advice. We're here to learn about the company. Chris, great to have you back. Congrats on the quarters. And please give us a quick overview on the results, and investors can see full results in your news release and filing statements available on your website. Thanks a lot for joining us.
Yeah, thanks very much for having me, Martin. It's great to be back. A great quarter for us. I mean, Q2, if I compare it to Q1, revenue was up, gross margin was up, gross margin percentage was up. We had record adjusted EBITDA in our US operating segment, which is our biggest segment. Certain categories of our expenses were down, and so all that led to record results for us on a consolidated basis as it relates to adjusted EBITDA. So a lot of the changes that we've been talking about, or I've been speaking to in my commentary over the course of the last, I guess, 3 quarters have panned out. And the results, of course, is being record results for us. So pretty happy with the quarter, and looking forward to what's next.
All right. One of the areas where you seem to make great strides in is on reducing costs in your SG&A level. Could you just describe what's been going on there, and is there room for additional cost reductions there?
Yeah, I mean, we take a deep dive at all of our operations. Head office, Canadian operations, and US operations. Those really being the 3 segments we report on. And we probably had a little bit of duplication in some areas, and so we eliminated some positions. But I'd say most importantly, in terms of one of the things that had the largest impact, was just looking at our leadership capacity, and where we saw certain leaders across the organization that were doing really well with their agencies. We gave more agencies to them, and so they took on additional responsibility. And so I think between just making sure that we were as efficient as possible as an organization, and also giving our leaders even greater challenges, I think those are the 2 primary things that really led to the results you see today.
All right. Do you have a lot of room, do you think, for additional cost reductions there, or are you more focused on, let's say, business growth at this point?
Yeah, we're definitely more focused on business growth. I mean, again, if I were to sort of look back at my comments in our press releases the last few quarters, I think I've probably spoken enough about efficiencies and combining some positions and so on. I think we've done a pretty good job of that. I know we've done a good job of that just based on results. But I think we're where we need to be, and I think really right now it's focused on revenue growth. As good as the results were for the quarter from an adjusted EBITDA perspective, there's still a lot of room left for improvement. And I know over the years I've spoken about incremental improvement, right? Making small changes, small improvements here and there. And my belief is that when you combine a bunch of small improvements, that leads to a pretty big impact across the organization. And really, I think that's the way that's the result of those, a number of incremental improvements. And so there's still a lot of improvements we can make across the organization. So from my perspective right now, it's about building upon where we are. But I see that more on the revenue growth side, which obviously increases our gross margin, and then goes to the bottom line. So that's really where we're focused right now.
All right. And we've discussed this in the past. One of the limiting factors in your growth isn't so much customer demand, because I believe that is fairly substantial. It's the hiring situation of the caregivers. It's a tight employment market. Can you discuss what that environment is like right now?
Well, it's better than it was. So, I mean, it's definitely better than what it was. I mean, I think it was the worst we saw was probably a year or so ago. And so, yeah, it's improved. I mean, is it where we'd like to be? No, but I mean, if you were interviewing me 20 years from now and you asked me what the number 1 challenge is, I'll tell you it's staffing. I mean, I just don't think that's ever going to go away. So the good thing is it's improved, which means we have access to a greater caregiver base, which means we can provide more service to clients. You're right. I don't think the demand is ever going to be, for several decades, just given the demographic trend, we'll have lots of demand. So, it's a good sign for us. We have access to more caregivers. Do we have as many as we would like? No, of course not. The industry as a whole doesn't. But again, I think that's going to be a challenge that we all have for years to come. So good thing is it's a little bit better than what it was, but again, it's always the number one issue we face.
All right. You have both Canadian and US operations, both posted positive operating income. Can you, are they as similar as one would appear, or are there some dynamics within the Canadian and the US market that make those a difference? Could you just sort of a bit of a review on how those two operations are both similar and different?
The nature of the work we perform is the same, right? Again, mostly non-medical care, dementia care within the home, or one-on-one within a facility. And whether that's in Canada or the US, there's really not much difference. Same type of care that we would provide. I think the differences that you may get in the US that you don't always get, at least when we operate in Nova Scotia, is on the licensing side. And so there are certain states that are licensure states. And so you might have a little bit more, administration you have to deal with, I guess, in some states. But, people are the same in terms of their backgrounds, and the nature of the work performed is the same. From a financial perspective, last year, Canadian results had record results for the Canadian operation. As we saw, which is pretty clear in our MD&A, the U.S. operations the last couple of years have really taken a big hit through the pandemic, which is why I think we were up somewhere in the 90% range quarter over quarter from an adjusted EBITDA perspective. So works the same. Financial impact of COVID obviously was vastly different, but great to see a fairly significant rebound in the U.S.
You report in US dollars, even though you're a Canadian company and listed in Canada. Can you quickly highlight or review how does, if the Canadian dollar drops or increases relative to the US dollar, how does that affect your financials?
Yeah, I think sometimes people forget we report in US dollars, because it's shocking to me sometimes how low our stock price has been given our results. And I often wonder if people think that our results are in Canadian dollars, which of course you've alluded to, they're not. But really it's so first, it's a non-cash item, right? So the only impact on financials really is just a foreign exchange gain or loss that's shown. No impact on operations. I mean, we have US bank accounts, we have Canadian bank accounts. We have US denominated debt for our US agencies. We have Canadian denominated debt, which I can speak to in a second, by the way. And so, there's very little in terms of true foreign exchange currency translation that happens. So it's basically an accounting entry that's made every quarter. And so one quarter you may have a large gain, and another quarter you may have a large loss, but has absolutely zero impact on operations and the cash flow of the company. And just from a debt perspective, I think what's important to know here is that from an allocation of capital perspective, we've been paying off a significant amount of debt, both on the promissory notes and the bank debt side. And our bank debt's projected to be under $300,000 by the end of this year. And I think we'd have another $120,000 of promissory notes. So, we're getting pretty close to being a debt-free company, with positive cash flow. And so someone the other day said, we're kind of like a blue chip company in the nano cap space. I don't know if it's possible to be a blue chip company in the nano cap space, but, we certainly manage the company like a private business. We manage it like, we're around for the long term, because that's our intent. And so I think we've been really prudent from a financial perspective, which is why we're in such a great position.
All right. And going back to the FX, really, your head office is based in Canada, but when your US revenues have their major expense associated with is US labor and services to fulfill that. So you don't have a mismatch of revenues in one currency and you're selling inventory that's been bought in another currency or anything. So the whole business is very kind of well matched on a currency basis. So there's really not really any kind of risk out of that, right?
No, we kind of have a natural hedge, because we've taken, in the former acquisitions that we've done where we have taken on debt, we typically took those in the country denomination. So if it was a U.S. agency we were acquiring, we take on U.S. denominated debt. So you've got a natural hedge. And then on the Canadian side, if we bought, for example, we did our company in Halifax back, I think in 2018, we took on Canadian debt at that particular point in time. So again, very little like actual dollars that we would translate from the US to Canada or vice versa. We keep them very much separate, which is why when I refer to the foreign exchange currency gain or loss, it's not a true monetary gain or loss. It's just simply an accounting entry because we have to state everything in US dollars, as you alluded to at the beginning.
All right. You are an acquisitive healthcare services provider. You mentioned you're reducing your debt levels and should be quite relatively minimal by the end of the year. Does this set you up for new M&A opportunities? And how is the M&A pipeline looking right now?
So maybe I'll answer that in reverse order. I mean, in terms of pipeline, I mean, it's like it'll never end. I mean, there's thousands of these companies that are available, or even to start new locations, the same premise, right? It just given the demographic trend. I certainly believe that because of the way we've set the company up financially, that we're well positioned to continue on with the acquisition, pipeline or trend like we have in the past. And that's certainly intent is that we'll be back in the market acquiring some companies. When that happens, obviously we'll make announcements. But I mean, think about the position we're in. We paid down debt substantially, and we've got the company on what I think is excellent financial footing because of the adjusted EBITDA record we just set, which to me now is kind of like what we expect to go forward, right? This wasn't. I don't sit here and say, well, this is a blip, it's a one-off. I mean, I think we've made the changes to the business that we need to make. And so is there going to be some plus or minus in a given quarter? Sure. But I think this is sort of where we are. So, if we did just under $400,000 of adjusted EBITDA in a quarter, and we're going to have under $300,000 of total debt with the bank at the end of the year, well, you kind of do the math and say, well, you have borrowing capacity, right? And if you look at the way we've done deals in the past, a little bit, we're not buying big businesses, right? I mean, we buy mom and pop businesses that, it might be 1.8, $2 million of revenue. I think we've gone as high as maybe 4. So we have the ability to go out and acquire a couple of businesses from my perspective, which, when you think about how small we are as a publicly traded company, percentage wise, each of those businesses actually ends up being, a decent number. So, that's kind of where we are right now. That's how I look at it. Again, I think we're in a great shape financially. I think we've got the ability to do some deals, and now it's just a matter, I think, of getting back out there on the acquisition train.
Given your history and it's still you're not an old business, shall we say? Has your flavor towards opening a greenfield or your taste towards opening a greenfield operation versus an acquisition, has that changed? Are you looking at greenfield opportunities with a greater priority at this point, or can you describe how you balance out those two growth options?
Yeah, it's an interesting one. I mean, we always look at that every year as part of our budgeting process in terms of where we want to allocate capital, right? I mean, right now we have some great operators, and so if they told us that there was a potential acquisition in one of their areas, and we thought it was going to be a good return, I think we'd follow that, that strategy. If they said, look, we just don't think there's going to be some opportunities within this marketplace, again, we look at that and say, okay, well, do we want to go further afield, somewhere where we're not, or could we simply open a new location in a different part of the state, right? That's kind of how we would look at that. I would tend to lean towards going a little bit deeper in the areas where we are right now. I think we're well positioned to do that. So, but that's how we view that, right? We kind of look at that and say, well, we have an office, our infrastructure, we have the technology, we have the people set up in that region. How can we further leverage, those people, technology, and infrastructure to build the business out further in that area? And my preference would be to do that versus, again, going further afield. I think the last few years has set us up well for the geographies where we are. And now, to me, it's about going a little bit deeper in those areas.
All right, you've got the map behind your head there. How many sort of core hub areas do you currently operate in?
Well, we look at it really in terms of regions, or kind of the way we view it. So we have, the Nova Scotia region, which is our Canadian operations. Then we have, like the New England area. That's kind of how we look at it. So Massachusetts, Vermont, Rhode Island, New Hampshire, like that. That's kind of an area for us. And then we have, I guess, kind of Midwest, if you want to call it that, where we're in Louisville, Kentucky, and Cincinnati, Ohio. Like that to us is a different region. And then the other region that we have would be South Central region. So Oklahoma, Arkansas, Texas, and we have South Carolina. That's sort of we kind of add in there. So that's those are the three real regional regions that we currently operate in the U.S. and the one in Canada. So that's kind of how we view it.
Okay. I think we've hit the high notes and we've gone through the questions I wanted to get through. Is there anything you want to add or comment on before we wrap things up?
I don't think so. Look, I appreciate the questions. Always great to chat. I just ask investors to take a hard look at us. I think if you look at our stock price, it's from my perspective, it's a pretty attractive price, which is why I continue to buy in the market and why our insiders have continued to increase their position. So, if there's any other sign of confidence in that, I'd like to know what it is, but I think we're in a pretty good spot. So have a look at us. And if you like what you see, then, dip your toe in and keep an eye on us, but I appreciate your time today.
Chris, thanks a lot for taking the time to chat with us and bring us up to date on Nova Leap Health. Have a great day and talk to you again soon.
Thanks, Martin. Appreciate it.